I'm Dr. Ian MacArthur. I am a board-certified plastic surgeon specializing in cosmetic breast surgery. One of the most common breast operations that I do is something called a breast lift. This is something that's done either by itself or it's done with a breast augmentation, and so that's a combination breast lift augmentation. The other name for a breast lift is a mastopexy. There's different types of breast lifts, and we really pick what type of breast lift based on our patient's anatomy and what their goals are. There's really three main types of breast lifts. One is something called a periareolar breast lift, and in that case, we're just raising the areola maybe a centimeter or so. This is the least powerful breast lift technique, but it has the smallest amount of scars. So the only scars that we see are just around the areola in a circle. The next one is something called a lollipop breast lift or a vertical breast lift. With that procedure, the scar is circular around the areola and then straight down, so it basically looks exactly what it sounds like. The last type of breast lift is called a wise pattern or an anchor pattern. It's the same as what you'd see on a breast reduction. So it's a scar around the areola, straight down and in the crease. When you and your surgeon talk about what type of breast lift we're going to do, it really depends on the degree of the lift that you need. If you just need a very subtle type of a lift, you might be able to get away with just using that periareolar option. If you need something more aggressive, so this would be like a case where someone's lost a lot of weight or has a lot of post-pregnancy changes, you need that anchor type of breast lift. When we talk about breast lifts, we're not actually lifting anything. What we're doing is we're tightening tissue from below. The term breast lift implies that we're lifting something up like that. That would involve putting a scar up here, which no one would do. So with this operation, we're basically tightening tissue from below to give more fullness and to give a more youthful looking breast. This operation typically takes between 1 to 3 hours, depending on the extent of the work. If we need to use an implant at the same time, this usually takes between 2 to 3 hours. Patients will have less choice in the type of implant that they can use because using an implant and doing a breast lift, these are very competing operations. So a breast lift is tightening tissue and tightening skin and doing that to raise the breast up, but the implant actually needs that skin to cover it. So we don't often use very big implants when we do these cases when we're doing combinations. These are things that we can talk about or you can talk about with your plastic surgeon and just to come up with the best operative plan possible so that you're fully aware of your choices and the advantages and disadvantages between your different options before your operation. If you're interested in learning more about cosmetic breast lift surgery, please contact our clinic.